two wonderful speakers, Steve Oss as well as Damon Jones. And so Steve Oss is going to lead us off, and he's the director of Washington State Institute of Public Policy, which is a nonpartisan research arm of the Washington State Legislature. He has 37 years of experience in conducting cost-benefit analysis and communicating the results to policymakers in a wide range of public policy areas. And some of his current work focuses on identifying and evaluating the cost and benefits of program and policies that reduce crime, improve educational outcomes, reduce child abuse and neglect, improve mental health, and reduce substance abuse. He also has much experience in the areas of energy, economics, and regulatory policy. And so without further introduction, Dr. Steve Oss.
Thanks, everybody, for having us here to talk today. I'm going to get to the valuation question in a second, but I thought it might be helpful to give a little bit broader overview of what we do for our legislature in Washington State, because we've developed standards, the kinds of things that everyone's talking about here today and tomorrow. We've had to do that because our legislature has required us to get this information out to them. So over the last 20 years or so, we have put together some standards that we use to judge, to make buy and sell decisions for our legislature. We get asked by our legislature, should they be investing in early child education? Should we be buying nurse-family partnership? What kinds of programs should we be selling as well? And my job is to give them buy and sell information. So we've put together a formal process to evaluate what works and what doesn't work, and to put a monetary price tag on it, and to provide that information to the legislature. So I'm going to give just a little bit of an overview of that before we get down to some of the topics at hand here. There's the Institute. There's the Olympia, the state capital of Washington. I'm going to show this thing here because the very first and most important principle is whatever you come up with here, it's got to be able to be intelligent in a place like that. Not in this room. The people that work in there, those 147 members of that legislature, are not the people in this room. And whatever we come up with, whatever I come up with for them has to be, I have to be able to explain it to them. If I can't explain it to them, it may be a great idea, but it's not going to work. It's not going to move policy. So if the goal is to move policy in these areas that we're talking about, in a capital city like that, there's the Capitol, there's Seattle, that's Saltwater there, there's the Institute, and my house is right there. So it's a real place. It's not an academic journal article. It is a real place. They get together every year and pass a budget spending billions of dollars on K-12, on social services, on a whole bunch of other things. And increasingly over these 20 years, they've been asking for evidence-based, what works and what doesn't, and what's economic. So I want to give a little bit of an overview of that. The Institute is it's a nonpartisan creature of the legislature. We work directly for the legislature. All 147 members are my boss. They hire me to give them that advice. It's a general purpose thing. We do whatever they tell us to do. Everything that I'm going to show today is because the legislature has passed a bill and said to the Institute, does this work, does this not work? And so we don't start studies on our own. We only respond to policies that pass the legislature signed by the governor. Those are some of the areas in the area of what works and what doesn't work, that kind of an investment role that we play. Those are the areas, those are the outcomes that we've been asked to look at. And if you can read those years, those are the years of specific legislation passed to say to the Institute by the legislature, tell us what works to reduce crime, juvenile crime, adult crime. In those years, education, early education, child abuse and neglect, you can see the other outcomes that we have. There's nothing up there on transportation, nothing up there on natural resources. I think those are coming. I think there's going to be something for us to do on transportation this year. So the idea of having an investment advisor on the spending side of government, every state has somebody that does their revenue forecast, but now increasingly at least one state legislature is getting used to using the information on the spending side of government. And so that's the context a little bit for what we do. When we get asked by the legislature, we go through a three-step process of what works and what doesn't work. And it's pretty straightforward. It's the evidence, what works, what doesn't. The next panel is going to talk about the standards of evidence for determining whether programs work or not. That's what we do. We tend to use a meta-analytic approach on usually narrowly defined topics, not broad topics like we were talking about this morning. We want to know, given the state of the research somewhere in the world, probably someplace in the U.S., if we tried something in the state of Washington, would it likely work or not? And so we throw out a lot of studies that aren't relevant for Washington, and we try to get them on topics that are specific ones that are fundable or defundable by our legislature. We put all studies together rather than picking a favorite study. I think that's good science. It's also good politics, because if you go in and I testify in front of the legislature with one study, they're going to, even though I've been their advisor for a couple decades on this stuff, they're going to be suspicious about that. So when you come in and you're able to say, we've got every rigorous study that's been done on functional family therapy, and here's what we find. That has resonance there in a context that works pretty well. Then the economics comes. If something passes that first test, we got evidence that something works or that something doesn't work, we then kick it up a notch and we put monetary valuation on the outcomes. Talk about that in a little bit. And we use the underlying word there is a consistent framework. That framework is developed over time. It started off as a simple little spreadsheet back in the mid-1990s on juvenile justice, and we've grown it over time, and so now it includes labor market outcomes, it includes child welfare, all the other things that we saw there. But it's a consistent approach. When we're analyzing labor market outcomes, we use a consistent data series to analyze the wages and earnings and growth rates on those earnings and so on. I may be wrong. I hope I'm right. I hope it's not a foolish consistency, but we're consistent in the modeling approach, and we think that's very valuable, because the goal, I think, as I think Janet Curry mentioned earlier, is to make apples-to-apples comparisons, and to come up with a list of options, evaluated on a consistent basis, and so that you can use that to help form budgets. And that's what we do in portfolio stage, our third step. It's not enough to do steps 1 and 2. That just tells you what works, what doesn't, maybe ranked by return on investment. But every year that legislature writes a budget, and you need to know how many slots of nurse-family partnership you're going to fund. And this raises the bar, analytical bar, 1 step higher, because now you got to start worrying about diminishing returns. You got to start worrying about kids that might go into multiple programs, and what are you going to do with those effect sizes if they're going into multiple programs? So, but that's the step that actually gets budgets written. Steps 1 and 2 are necessary to get down to step 3, but it's step 3 where you begin to assemble the information into the House and the Senate budgets that ultimately get passed and signed by the governor. So all 3 of those steps are part, I think, of the whole process of these standards that we're talking about. When we get done, and I would encourage you to have a standard on this as well, and that is, how are you going to present the results? Even all the trouble you're going to do to prepare them and all the things that have to go in there. We've developed, and have done it now for 20 years, a consistent consumer reports-like format. It looks like that. You don't have to worry about reading those numbers, but they all look like that. So if you're a member and you're sitting on the education committee, you're going to see the Institute's results for K-12 education in a table that looks just like that. If you're on the Juvenile Justice Committee, you're going to see that. Child Welfare Committee, you're going to see the same kind of report. So the members who go around from different committees over their careers, they get used to seeing this information in a standardized way to present it. And we have found that this is probably more important than anything else. Last session, I was testifying, I do all the time in from the legislature, I was testifying on K-12 education, and it was a very short presentation, and so I left off the actual list of things, and the committee chairman got me afterwards and said, every time you appear in front of my committee, you have to show that list. I said, okay, we will. So it was a sign to me that this actually has worked over time, that it helps members get the concept across that it works. So I'm going to do NFP, that was mentioned earlier here, to try to talk about how we value a little bit. I can only touch on this stuff here in a few seconds here. Nurse-family partnership, which I guess everyone knows about, so we don't need to talk about what the program is. So this is the results of our most recent running of the model. We think that in Washington State it costs about $97.88. We do it, the costing side, by figuring out how much it actually costs to do the program in Washington State, given Washington State labor markets. Because you've got to hire nurses, and nurses are priced differently in Washington State than they are in the average state. So this is a Washington State specific price. When we do the costing part of the analysis, we actually add up how many hours of service, how many hours of therapy, how many hours of instruction time, whatever the topic is involved, and then we price it out at what we're actually going to probably have to pay in the labor market for Washington. So this is the NFP price for that program. One of the outcomes that has been measured, of course, from the program in those 3 randomized trials is reduced child abuse and neglect. And we monetize that outcome in several different ways. One, we recognize, we built a model to model Washington's child welfare system. So that CW up there is the child welfare system. Looking at the marginal cost of the system, all the way from substantiation of a case coming into the system to that proportion of the cases that get placed out of home and what's that marginal cost for foster care, to adoption support and other services that are provided to those youth on a probabilistic basis. So we actually model the incremental cost of the system and in a formal model using Washington state rates and the probability that cases get into different parts of the system. That's for the child welfare component. This is sort of an ingredients-based model. Then for child victim costs, we don't invent our numbers there. We use some national numbers to go along with those victimizations. These are generally willingness to pay numbers that Ted Miller and other people, Mark Cohen, has done in the past. And we borrow those numbers, figuring that if you're an unfortunate victim of child abuse and neglect, the national numbers are probably good enough for us. We certainly don't have the resources to go out and compute the numbers on our own. So that's how we end up monetizing by multiplication the effect sizes that are measured from child abuse and neglect. There's many more analytical steps and so on. Increased educational attainment has been found for the program, test scores primarily for the kids, and high school graduation rates for the mothers. Borrow Hank Levin's model. Our model reproduces his number almost exactly. We got Washington state numbers, my own assumptions about there, but it's very close in terms of the value of high school education and test scores as well. We use some of the work that Heckman and others have done analyzing test scores and the long-term impacts on earnings in the labor market. Reduce crime. This is both for the child and the mother. One's significant, one isn't significant. We monetize them both, including their standard errors, as we'll see in a moment, in Monte Carlo. And again, we're now modeling the criminal justice system costs for Washington State. We've built an elaborate model, because we've been at it for so long, of the criminal justice system, every step from arrest, the formal process, arrest, through the whether you're juvenile, whether you're an adult, the process through the system, the marginal cost on each of those nodes, all the way up through juvenile incarceration or adult incarceration and community supervision afterwards. So it's all modeled in there on a probabilistic basis, and that's how we take an effect size for crime, project out what we think it's going to be in terms of the change in criminal justice system cost. And then, of course, if there's fewer crime, there are fewer victims, and so our model handles that again. And there again, we're using a recent semi-meta-analysis of the best willingness to pay studies out there that have been done by McAllister, and those are the values that we have in the model for the victim cost of that. So they see those. There are other outcomes. It turns out increased K-12 costs. The kids are retained a little more often. They use a little more special education, the kids that went through nurse-family partnership, so there's some increased K-12 costs we can plan on there. Public health costs that we can see in there and so on. And then we also include deadweight cost of taxation of the programs. We have a little check. You can run the model with or without it. We follow Heckman's analysis of Perry Preschool here and actually use his assumptions about a 0 on the lower bound, a value of 1.0 on the upper bound for the cost, and a 0.5 in the middle. So this is going to be about the 0.5 level for the deadweight cost of the program. We end up with total benefits per family of $2,600. These are all present value dollars. So net present value of $16,000 or so, $17,000 per family. Benefit cost, you can do the calculation there, $273, and an 8% internal rate of return on investment. So that's, in general, that's how we do this. Whether if we're looking at K-12 outcomes, we're going to be looking at programs to do that. If we're looking at juvenile crime, it's going to be a different set of outcomes. But the internally consistent modeling approach follows all of those procedures. We then run Monte Carlo. Monte Carlo has been talked about this morning here. We vary all those standard errors. You got to make, one of the things the demands on the model here is that on those mean effects got to be right, but especially your standard errors are going to have to be right. If you're going to go to Monte Carlo, you got to make sure you've done the right ICC things, or you're going to get goofy results if you've got studies that are done at an aggregate level, and you got other studies done at an individual level. You got to decide what you're going to do it in so that you get the right standard errors. And then we run that and all of the other factors that are in the model around which we have risk. And we have risk around many factors other than the primary effect sizes. We have risk around those marginal costs for crime control. You know, how much does it cost? All those numbers have error around them. We run the model 1,000 times, I think what this case was, and we find out for NFP that 76% of the time you get an NPV of at least a positive number. About 24% of the time it was a negative number. So so those are the two pieces of information that I give to the legislature. I give my best case for NFP, which we saw on the previous slide, and I give them one piece of risk and uncertainty. What's the chance that you're going to go belly up, that you're going to not even make enough to pay off the cost of the program from a total state perspective? And so this investment looks pretty good to us. It's a little bit more risky than I think people commonly think about the program. I'm nervous about the program. I want to see some more evaluations of the program. I can't wait for the new evaluations of the program to be done because there's only 3. None of them were done in Washington. It makes me nervous. I don't want to let the legislature think this is a complete slam dunk. It may not work out, and that's why it's important to do Monte Carlo. Now, I did do an analysis. This is my interpretation of David Olds' research, those 3 research studies. And one of the things I'm worried about, and I think there's reason to be worried about, is whenever the developer of the program has been involved in the delivery of the program or the evaluation of the program, you got to be worried. And I'm worried about that. And so I've discounted David Olds' effect sizes to account for what I think the latest meta-analyses are indicating you got to be worried about to that degree. If I run my same model at David Olds' full evaluation outcomes, this is what I get. The program looks a lot better, a $38,000 NPV, only a 5% chance of a negative outcome. So my interpretation of David Olds is that, of the research, is that you've got to be a little bit nervous. Not that David Olds cooked the books, but that he was such a outstanding person when he was doing those trials. We're very committed to making sure the program works, and it may not be possible to get that same result in the real world of application. We don't know that until more research is done on the program. That's why my numbers are a little bit more cautious, but they're consistently cautious because I take that same approach for every program when a developer has been involved in the program or not. So that's a little bit on how we do the work. I just give some suggestions that we've gleaned from doing this stuff for 20 years in one location, trying to make it policy relevant for the legislature. Most of these things, again, we've learned the hard way because through failure, not through success. But we've learned our chops, got our chops down there. And again, the first one is that Olympia factor. You got to be able to explain this stuff to, if not all 147 members of the legislature, at least to the committee chairs and the majority leader and the ranking members. If you can't explain it to them, if you can't explain why this is a good investment or a bad investment, it's not going. This information that might be fun to produce, might get published in journal articles, but it's not going to inform policy. So it's very important to use some methods that are intuitive enough, but also appropriate enough to scientific standards. Apples to apples comparisons, we mentioned that earlier. I think it's very important to rank options, not just to go in with one study and say this is the finding, but to actually say you got several options to reduce crime. If you want to reduce juvenile crime, here are your options. Here are your evidence-based options. Some of them work, some of them don't work. They're all evaluated with the same way. So the apples to apples consistent framework is, I think, an important aspect, a principle that works over time. All these things that when are calculated in dollars should be done on annual cash flow basis so that you can do all the things you need to do with it, just to do NPVs and so on. And you need to break it out into at least 3 perspectives. We use 3 general perspectives. We look at the taxpayer perspective only, we look at the participant perspective, and then others categories, a general category for like crime victims or other victims that be in people in those other non-roles. because different members want the information for different things. We try to give overall results, but the fiscal committees of the legislatures is going to want to know what can they book in the next coming session. So you got to have those cash flows broken out, even if roughly, by the taxpayer components in addition to the total component. And then, as has been mentioned around this morning so far, assessing risk is very important. And if you do a full assessment and you bring in all of the risk and all of those factors that go into a benefit cost analysis, not just the effect size from the program itself, but all the other stuff that has to go in there, and you put appropriate risk around there, the overall riskiness of those findings are going to grow. They're not going to shrink as a result of that. And I think that reflects accurately the uncertainty around some of these estimates. Some additional thoughts: you got to be really careful, especially for the prevention programs, other programs, to not double count benefits. Sometimes you'll have outcomes that are really measuring the same human capital construct. You might have some program that measures test scores and hangs around long enough to measure high school graduation. And if you're going to use labor market earnings, you could get separate paths to those. And you probably don't want to just combine them both into a total thing because they're measuring some of the same work. So you have to develop procedures, I think, and we have some, we call them trumping procedures, when we think outcomes collide with one another so that you don't double count constructs that are measuring the same thing. Again, be wary of evaluation results from developers. Mark Lipsey's meta-analyses, our own meta-analyses, really do indicate that for whatever nefarious or non-nefarious reason, effect sizes are always bigger. You get a bigger bang for the buck when the developer either does the evaluation or is involved in it. And we can say why it is. It's just that if you want to go real in your own real world, you better be prepared to have probably a smaller effect size than what you would for those kinds of studies. Local conditions vary in the U.S., so you really, we might try to think about a national model, but it's really a state by state or even a locale by locale. Labor markets are different. Prison policy, for example, is different and very different in Texas than it is in the in Washington State. So the same program that reduces crime in Texas will save a lot more taxpayer dollars than it will in Washington State, where we don't send so many people to prison. So you need to have those be state-specific numbers, local conditions number. Diminishing returns are going to be different in different places depending on where each state is at the time. Expect to make at least annual updates and results to the methods. We do this every year. We just put to bed the model that we'll be using for the legislative session that's going to start in January. We just finished it. This is this year's version of the model. We made a bunch of new improvements to the model and how we do a bunch of things. That model will now be used in the coming session, and we're already starting to work on the model that a year from now we'll have with the latest factors that we haven't yet considered that we know we need to have in the next model. So this is not a one-time only thing. It's an ongoing effort. This is what we've been doing for 20 years in Washington, each year making the model a little bit better, consistent with what we think is appropriate. And then finally, this is one of the insights, and I think, I hope, at least this is what's important to us in doing this benefit cost work, is to not only use the primary program evaluation literature. Does Perry Preschool work? Does Nurse Family Partnership work? Does functional? That's the next panel is going to talk about that. But to also use the longitudinal research out there that links causally, and probably to meta-analyze the longitudinal causal research that links things like Janet Curry's work that links child abuse and neglect to downstream outcomes like child abuse and neglect and crime, because the program itself that you're looking at may only measure child abuse and neglect, and yet you want to make statements about you think there's probably a linkage to crime later on in life or to the inability to graduate from high school, and you need to rely on some of that best longitudinal research that's increasingly being done with big data sets. Janet's work is all over our analysis in terms of her effect sizes that she's done for childhood disorders and child abuse and neglect. And then also borrow from the best thinking. Many people, Hank here has spent a lot of his career focusing on how to place a monetary value on getting someone to graduate from high school. When it came time for us to build that model, I didn't go out and sort of redo all that work. I went to Hank's work, and there's several other economists that have been doing that work, and I simply took their methods and monetize it with our own numbers about low wages and so on, but it's wages, it's criminal crime outcomes, it's healthcare outcomes, public assistance outcomes, those four things. When I run my model, and I get a number quite similar to the number that Hank has, is the model. So there's a lot of work out there already on these things. A lot of people have spent their whole careers trying to focus on what does a case of child abuse and neglect substantiated case cost victims, and so we just try to bring that best of that research in. So I think that as the second panel focuses on what works, it's not just the primary program work, but it's the longitudinal work, and then it's the evaluation methods. So if you want to go to our website, you can see this. Just launched our brand new website, just updated this to try to make it more useful for our legislature. You can go there, you can click on our benefit cost results. Up will pop information about the programs, about the cost of the programs. You can click on individual programs there. You can find out our current run of the model, all those results we just saw. Monte Carlo, this is a juvenile justice program, and our current buy and sell recommendation to the legislature. And I'll close there, noting that amazing to me, after having done this for 20 years, how much of our state budgets in crime, juvenile justice, increasingly in K-12 education, it's a little bit slower uptake there, in child welfare, children's mental health, and soon to be adult mental health and substance abuse, are being written by these findings. It kind of makes me nervous, you know, but it's gratifying in the long run that if you stay at something this long and the legislature gets used to the messenger coming at them with that information, and the messenger is not perceived as being biased one way or another. Messenger's got negative findings and positive findings. They don't know whether the messenger is a Republican or a Democrat. They don't know that, and they don't need to know that. And that tends to work with the legislative process, at least it does in Washington State. So we'll close there, and thanks very much.
Thank you very much. So our next speaker is going to be Damon Jones, and Damon is a research assistant professor at the Bennett Price Prevention Research Center at Penn State University. He has several years of experience considering the potential of positive economic impact on effective prevention efforts. He's collaborated on a number of projects focusing on the cost and cost effectiveness of programs involving either targeted or universal-based policy delivery. His funded research has been looking at crime and delinquency on the potential return of investment for Pennsylvania-based interventions aimed at reducing substance use, and delinquency. So, Damon.